Hello, everyone. My name is Martin Chigwede, and I am a student nurse midwife from Malawi. And throughout this presentation, I will get to share with you my experience and perspective of being a student nurse midwife during the pandemic in a low resource country. And I'll also share with you my perspective on the state of midwifery education in a low resource country. So as I said, I'm going to share with you my experience of being a student nurse midwife going through midwifery education during the pandemic in a low resource country. I am a fourth and final year student nurse midwife, currently studying towards a bachelor's degree in nursing and midwifery science at Daeyang University in Malawi. I am a sexual and reproductive health enthusiast and peer educator. And throughout this presentation, as I've already said, I'm going to share with you my experience as a student nurse midwife during the pandemic and share again my perspective on the state of midwifery education in Malawi during the pandemic. So midwifery education in Malawi is offered by a number of institutions, academic institutions, and I am currently studying towards a bachelor's degree in nursing and midwifery science, which is a 4 years long integrated program recognized and accredited by the International Confederation of Midwives. Now, responding to the pandemic, the current global pandemic is ongoing, and it is a fact that the ongoing COVID-19 pandemic has affected and has slowed day-to-day lives together with world systems across the world, with midwifery education not being spared. Malawi, on the other hand, Malawi is a country in the southern part of Africa, has not been spared, and it was fairly affected. And as of the 1st of April 2020, Malawi had not registered any case of COVID-19 infection. In an attempt to maintain this, the then president of Malawi declared a state of disaster on the 21st of March 2020, and the Ministry of Education mandated the immediate closure of all schools and colleges in both the public and the private sector by the 23rd of March 2020. Final year nursing and midwifery students like myself were asked to await home and for further instructions, which was quite frustrating as I only had a week of theory classes left and about 4 weeks of clinical placement to undertake before completing my training. And it is a fact. And a fact is, right now, I should have been done with my training, and I should have been graduating in about a few days. Anyway, how did I get to react to this? So after a few days at home, I realized I had nothing to keep me productive during this time of great uncertainty. And with the knowledge I have that the scope of midwifery practice should exceed the childbirth continuum and encompass health promotion amongst women, babies, and the wider community, I decided to act and take up the leadership role with the skills I obtained while in my nursing and midwifery training. Now, following this realization, I performed an informal community health needs assessment and identified an intervention that would promote the health and well-being of the local population. And throughout this informal assessment, I noted a gap in the existing societal knowledge about COVID-19, and I identified the need for a COVID-19 preparatory awareness campaign that would support the community when COVID-19 inevitably reached Malawi. The idea or intervention that I had in mind centered upon education about how to prevent the spread of coronavirus through effective hand washing with directions from the World Health Organization. And I decided to embark on this, and I set up a COVID-19 hand washing spot outside my grandparents' house with only a few resources I had at hand. And at the time, I had a half-empty bottle of hand washing soap, a box of latex gloves, an apron, a few masks, and I proceeded to work on it. And on here, we have pictures of the days that I did the COVID-19 hand washing spot. I was able to implement the idea for about 3 days. And the first one here is the COVID-19 hand washing spot. That's a signpost that I had to write using an old paper, a calendar paper. I had to tore it and had to write it using a pencil marker and had to place it outside for people to see. And the second picture is me on the side holding a hand washing soap and in my scrubs and next to the spot. Now, how did my school react to the pandemic? So, in a desperate attempt to keep our studies going, my university commenced online learning. And in as much as this was a great development, one which responded well to the global pandemic and the new normal, a lot of doubts on the effectiveness of the program roamed among a lot of student nurse midwives from my class, including me. Now, the introduced online classes were, however, unable to deliver quality midwifery education. And as a result of a number of challenges, and those challenges range from being from technical challenges to not having practical sessions and information overload. So, on the technical challenges, Malawi is faced with a challenge of having poor internet connectivity and internet being expensive all around. And for those students that stay in rural areas and commute from rural areas, it was really hard for them because the rural areas are greatly affected by the lack of internet connectivity or poor internet connectivity. And as a result of this, they were not able to be sustained and to go through or online learning of the midwifery education. And as a result, some do not even get to attend. And the fact that also the internet connectivity is quite expensive in Malawi, this was a challenge as we were not able to sustain the online learning, let alone midwifery education. And the fact that midwifery education is a practical session that, in as much as there's a theory to it, the practical is equally important because you need to know the hands-on of midwifery education. And so because we had to stay home and we had to be quarantined, we had to maintain a social distance, we were not able to go through practical sessions. And as a result of this, we ended up having information overload that we had to keep and get in a whole lot of information and not be able to process it. And as a result, we would be left behind. I was one of the person that would be left behind without actually grasping the idea of what was being taught online. Now, getting slightly back to the old normal. Now, the Malawi government realized that the country is being greatly affected, and the rate at which the COVID-19 pandemic was going, it was quite manageable, and things would and should return back to normal. And following this, Malawi is slowly returning to the old normal. However, with COVID-19 precautionary measures being followed. So this follows the low incidence and high recovery rates plus low mortality rates since the first COVID-19 case in Malawi. And following this, education has now returned to being face-to-face in Malawi. And I'm very happy, in fact, that midwifery education has returned to being face-to-face interaction. And the fact that we are following these COVID-19 precautionary measures where we get to wear masks and frequently hand washing and maintaining a social distance and following all those precautionary measures that have been given to us by the World Health Organization. Now, moving on to what I've learned throughout this pandemic is that we as student nurse midwives and midwives, qualified midwives, we should take up the leadership role. In as much as we get to serve and get to work in the hospital setting, in our communities, but out of this scope, we have to take up the leadership role and we have to exist as leaders in our communities. So this can be in reference to our profession as midwives or not. And we can perform that in a whole lot of ways. For example, I was able to take up this leadership role and I was able to take up the role by implementing this project where I had to lead a couple of my cousins in implementing this project. And I've also learned that we have to be innovative. And as student nurse midwives and midwives, we have to be innovative. And by being innovative, we can do this in a whole lot of ways. I was able to do it throughout the pandemic by implementing this project and using old papers to write health education information on it and pass them around for people to see and get to learn and be equipped with information and how to prevent coronavirus in case it came to Malawi. Now that midwife education is back to normal and I'm nearing the completion of my training, what is next for me? So upon completing my training, I have to go through the routine, which is me completing my training and proceeding to writing Nurses and Midwives Council of Malawi licensure examinations. And upon passing the exams and being accredited, I have to now look for a job. It's not quite obvious and quite handed to you that once you get to pass the exams, you get a job right on spot. No, you pass the exams. It's quite different in Malawi. You have to pass the exams. And once you get to pass the exams, you have to now look for the job alone. And so I guess that's where I'm going. And I have to look for a job. And I plan to work for a year as a midwife. And then I have to proceed and do my postgraduate studies as a midwife now during postgraduate studies. And that is all I had on my presentation. Thank you so much for tuning in and being with me throughout this presentation. Thank you.